Breast cancer is to a large extent preventable. The American Cancer Society says that fewer than 15% of breast cancer patients have it in their families. So that means that more than 85% of breast cancer comes from causes that are largely preventable, like toxins in the environment and lifestyle factors. So you may not be able to prevent cancer 100%, but you can really change your odds. Typically, oncologists don't talk much about prevention because their focus is on killing the cancer. So for example, for me, I've been in remission since 2011, and they give me tests to see whether the cancer has returned. But if it has returned, it will probably be too late because probably it will have metastasized to other organs and no longer be curable. So I want to prevent it from returning. And conventional oncology doesn't offer a lot in that respect. There is another specialty called integrative oncology, and they believe there are two parts to cancer care. The first part is what conventional oncology does, some combination of surgery, chemotherapy, radiation, and hormones. But integrative oncologists believe that there's a second part, which is altering what they call your terrain, your body, to make it less receptive to cancer. So they build up your resistance with things like diet, supplements, sometimes prescription drugs, exercise, and stress reduction. So as an example of stress reduction, you've all heard about battling cancer. Well, I never think of battling cancer because to me, battling is stressful, so I think of it as curing cancer instead. Another big aspect of prevention is avoiding carcinogens in the environment. And they are everywhere. They're in air, food, water, personal care products, household cleaning products. They're very hard to avoid, and it can seem overwhelming. But you can make changes one step at a time, so it isn't as hard as it seems. I started in 2011 with the ones that were easiest for me, and then I just added on. All this is described in detail in the Thinking Woman's Guide to Breast Cancer. But the thing to keep in mind is that anything you can do for prevention is helpful. You don't have to do it all.